Now that we've learned some things about the history of behavioral therapy and some key figures throughout time who are continually affecting this type of therapy, we still want to take a look at some of the historical factors leading up to some of the major theoretical ideas or principles of the behavior therapy. For instance, we want to take a look at three specific waves. The first wave being the more traditional therapy, which started in the 1950s, as we talked about earlier, and it emphasized counter-conditioning and contingent management. However, Skinner's idea of operant conditioning mainly predominated the first wave. The second wave started in the 1970s, and it also had a development of a broader based cognitive behavior that incorporated the thinking dimension of individuals rather than focusing only on the environmental factors of the individual. So it focused more on cognitive behavior therapy, which became the predominant approach today, but now incorporates more aspects such as mindfulness and acceptance. The third wave, which now started in the 1990s, included a major approach which included dialectical behavior therapy, mindfulness-based cognitive therapy, and acceptance and commitment therapy. Not only did it include these types of therapies, its recent approaches up until today now admit to viewing human beings as having some kind of self-control, having some kind of self-will, as opposed to, as we learned earlier, Skinner's view of where humans have no free will at all. Aren't you glad you have free will today? Well, there are four theoretical ideas and principles we want to take a look at in behavioral therapy. The first being classical conditioning, the second operant conditioning, and the third social learning theory, and finally the fourth is going to take a look at contemporary behavior therapy, or also known as cognitive behavior therapy. Well, first let's take a look at classical conditioning, or also known as respondent conditioning. It refers to the way behavior is controlled by its antecedents, or what happens before the behavior, what causes the behavior to happen. For example, if you take a dog, for instance, and if I had my dogs here with me, I would demonstrate this to you live, but since they are not, here's a picture for you to get the full effect of using my dogs or any dog as an example. And if you take food and put it in a dog's mouth, it's going to salivate, right? Well, the salivation is the respondent behavior or unconditioned response to the food, which is known as the unconditioned stimulus. But if this act is repeated and then you add the sound of a bell, or in some cases the sound of a maraca, the sound therefore becomes the conditioned response, because as you give the dog the food and add the sound later, once you take away the food, the sound will then produce the salivation. Just one example of what you can find in classical conditioning therapy. It is an event or some type of conditioning that is producing the type of behavior you will find. Secondly, we have operant conditioning. Operant conditioning is pretty much the product of Skinner's views. It involves learning processes in which one's behavior is controlled by the consequences that follow the behavior. Also known as, maybe some of you have already heard, positive reinforcement and negative reinforcement. For instance, if a behavior is followed by pleasant or rewarding consequences, if I give you my hat because you did well, then I am positively reinforcing you. If also you have negative reinforcement, when you put the two together, the elimination of the negative reinforcement is likely to increase or be maintained. On the other hand, it can go the other way. If you are doing negative reinforcement, it can be decreased or eventually fade away. Reinforcement contingencies that are positive or negative reinforcement, punishment, or extinction are powerful interventions in the behavioral therapy modification of behavior. Take, for example, the pastoral context. If you saw a pastor or within any ministry within the church, you saw them reinforcing positive behavior with rewards, you probably wouldn't think that's the best way to operate the church or different ministries, right? Because then their actions, for instance, if they're coming to pray every day or if they're reading their Bible, they're receiving something for that, a tangible object, then it's probably not the right type of positive reinforcement. Just one example. Thirdly, we want to take a look at the social learning theory, or also known as social cognitive approach, which has paid more attention to symbolic processes such as observational learning or modeling, and its subsequent development of self-efficacy theory greatly influenced behavior therapy to more to more beyond simplistic notions of classical and operant conditioning. The interpretation of the environmental events surrounding the person, as opposed to only the tangible influence, like we just discussed, the tangible object, not always, but just in that one example, is more influence of the environmental events is therefore viewed as a crucial determinant of human behavior. Lastly, we have contemporary behavior therapy, also known as cognitive behavior therapy, which is a very well-known theory and therapy used today. It is one of the predominant therapies used today in counseling or different types of therapeutic offices or in many different areas. This is a major cognitive therapy used among those operating in this type of field today. So what is contemporary behavior therapy? It has developed, as we said already, into the predominant cognitive behavior therapy. It's influenced by social learning theory and self-efficacy. It has been defined as a more purposeful attempt to preserve the demonstrated efficiencies of behavior modification within a less doctrinative context, or to incorporate the cognitive activities of the client in efforts to produce a therapeutic change. So what does all that mean? It is trying to find a way to better involve and analyze the behavior modification of the client without being in such a strict context or environment. Also, it is accepted the importance of the individual self-talk, attitudes, expectations, beliefs, values, or one's cognitions or thoughts in influencing one's feelings and behavior. These things are very important things in influencing the individual. It has also incorporated techniques to modify maladaptive cognition or thinking in bringing about change. So if you think about the pastoral context, what do you think about when you think of this cognitive behavior therapy? Well, as we have learned already, and as I've read here for you, it is where a purposeful attempt is to preserve the behavior and modification of the people or client or individual that you're working with. And in many cases today, we may see, such as in a pastoral context, this happening more so than what we saw in the operant conditioning. And those are just a few of the features of development in behavioral therapy. These are some of the 4 main areas, as we've seen before, that contribute to the 3 and some others historical figures such as Wolpe, Skinner, Weckenheimer, and so on.